Today, we're gonna unpack a study, a really big one, that completely changed how doctors fight one of the world's deadliest cancers. Let's dive in. For the longest time, the main game plan was pretty simple, even if it was brutal. Just cut the tumor out. That was it. That was the best and often the only shot at a cure. But here's the thing. There was a massive problem. Even when a surgery looked successful, the cancer would often come roaring back. And that's because by the time a doctor even finds the cancer, these tiny, invisible cancer cells, micrometastases, have often already escaped. They're like little sleeper agents hiding out in the body.
And this number? Well, it says it all. Only 23%. That was the 5-year survival rate with just surgery.
So with a reality like that, researchers were basically forced to go back to the drawing board, to ask a really bold, almost crazy question. Okay, so here's where it gets interesting. Doctors actually had this super powerful weapon, a 3-drug chemo combo called ECF. But they only used it on patients who were already considered incurable. The thinking was, this chemo is tough, and for someone who might be cured by surgery, why put them through that? The risks just seemed too high for a benefit that no one had actually proven. And that's what led to the big what if. What if we stopped waiting? What if we used our best weapon earlier, before and after surgery, for the people who still had a shot at being cured? The theory behind this was just so smart, right? You hit the tumor with chemo before surgery to shrink it, making it way easier for the surgeon to get it all. Then you come back with more chemo after surgery to mop up any of those sneaky, invisible cells that might be lurking. It was like a 1-2 punch. And that's what set the stage for one of the most important clinical trials in the history of cancer treatment. And that was the MAGIC trial. I mean, this thing was a huge deal. They signed up over 500 patients between 1994 and 2002. The goal was crystal clear. Find out, once and for all, if this new strategy was actually better. Now, to make sure the comparison was totally fair, they split everyone into 2 groups completely at random. Group A got what was normal at the time, just surgery. Group B, they got the new experimental approach, chemo before and after their surgery. Did it work? Did this whole new idea actually make a difference? The very first clue was something the surgeons could literally see with their own eyes. The tumors in the chemo group were just smaller, way smaller. We're talking a median of 3 centimeters compared to 5. This is the number that changed everything. Look at that jump in 5-year survival, from 23% to 36%. That's a 13-point leap. The patients who got the chemo had a 25% lower risk of dying than the patients who only got surgery. It's just a really solid statistical way of saying the benefit was real and it was consistent. And the people who ran the study, well, they didn't hold back. Their conclusion, published in one of the world's top medical journals, was crystal clear. This new approach worked. Period. They created waves that completely changed how doctors practice medicine. Basically, almost overnight, this became the new rulebook. The MAGIC trial set a brand new global standard of care.